We are here in Birmingham at the Dental Hospital, and we're going to be getting a tour of the School of Dentistry with Dr. Satnam Virdee. First year, mainly science, theory.
Yeah, that's it. So it's basically bringing everyone up to kind of a same standard in terms of their knowledge and learning about the basics of the various systems that still have application in everyday dental procedures.
Would the lecturers be mainly ones with a purely scientific background, or would it also be lecturers who've got a dental background teaching that first year cohort?
So I think with my experience when I 15 years ago now, when I was in my first year of dental school, it was purely scientists or from the medical sphere who were specialists in those areas that were teaching. However, I think now they're adding a lot more dental application and it may be still those scientists teaching, but there's a lot more application to dentistry that they are teaching, and where that specific area of teaching is going to apply to your dental career. So I think that there's still a lot of scientists and medics that are teaching those systems, but there's a lot more dental application to them now.
That makes sense. And then, as you're saying, third year, you're looking to get them much more hands-on and practical.
That's it.
Seeing patients.
That's it. So as I said, in the old curriculum, it was the third year. You had a very hard start to seeing patients. And I remember when I was in third year, I had to do an MO on a upper 8. That was my first patient, and I'll never forget that. But actually, what we're doing now is we're bringing, with the new curriculum that's currently now in place, we're bringing the clinical years a lot forward. So I think the intention is to start seeing patients and doing basic procedures at the end of the second year, having done a operative skills course in the simulated environment in the start of the calendar year, effectively.
Must be very memorable for the students when they get to see that first live patient.
Indeed, and I think it's a different stress, because I think you will have had an academic, all up until that point. I think they will have had a very academic type of stress where it kind of comes in and out kind of thing, of where they have exams and then it's high intensity, and then where they don't, then there's kind of a rest period in a way, and it's just academic learning at that point. But actually, when they're seeing patients, I think it's a very different type of stress that they must experience. And we all did when we started with the seeing patients for the first time.
Well, let's have a look around.
Yeah, sure. Okay, so this is the simulated environment. It consists of 3 different areas. We have a 4th area here. Often a lot of the postgraduate teaching is carried out in this room. Okay,
so just for people that might not be aware, so these are dentists.
Indeed.
That you're now teaching extra skills.
That's it. So a lot of the postgraduate courses from the deanery or the university do often take place in this little room here. We've got scopes for all 3 bays. We've got really high-tech AV kind of systems to really help demonstrate and carry out some of those tutorials.
How often would this room be in use on a weekly basis?
Very, very common. So it's often used mostly on a Thursday and a Friday. And also it acts as an overflow. So in recent years, we've had, particularly down to the COVID years, we had a higher intake of students. And so where there would be an overflow on the main clinical skills suite, we often, they have some bays here to work with as well.
You're giving me memories of being back on the phantom meds.
Was it like that for UCLan or?
Yeah, UCLan, the setup was similar to your main room, but just much smaller.
Much smaller.
Yeah.
This way, we have our classroom here. This is one of our classrooms. Just here.
Wow.
So.
I can imagine it fills up from the back first.
Yes. To be honest, you'd be surprised. You still get some students quite keen students sitting at the front as well. So, but it often does fill up from the back. More so in the lecture theatres, I think. Yeah, and then we've got our kind of screen, so we can show at the various, in the staggered kind of aisles, I suppose, so everyone can see what the lecture is.
What was your first experience of lecturing like?
Very nervous. So I was very fortunate in that the lecture was a pre-established lecture in that the content was already there. But yeah, it was quite nerve-wracking. So spent a couple of nights before kind of learning the content of the lecture, and then also making sure, reading around the lecture so I can answer questions in and around that, because some of the students ask some really tough questions sometimes that make you think about the topic in a different way, and I suppose that enhances your understanding of the topic as well. So
I always think you can have in one room students who are at different stages of their understanding and how they grasp concepts. How do you try and get everybody, progressing?
That's a really good question, and I think that's something that is inherent with teaching large groups, that you're going to have individuals of different learning styles and different stages of their development and understanding of the topic. So I think it's difficult to do that in a large lecture theatre where you're effectively reading off slides. But I think we supplement those with once they learn the content, we try and then immediately get them to kind of perform the content either in a simulated environment or in on patients effectively, once they've met a certain standard of clinical safety. But when you're in much smaller groups, it may be a little bit easier, so you can accommodate by kind of providing tutorials in different formats. So every time we do a lesson on the simulated environment, we have about a 45-minute to hour-long tutorial initially, and in that you discuss the topic, have the opportunity for students to ask questions. There's some video format kind of content available to them that they can pre-access.
That's good.
And also we then, with those scopes and the AV visual system, we then also provide them with a live demonstration, so they can actually see an individual and a qualified dentist doing the procedure that they're being asked to do, and all the mistakes that commonly come with it as well. So you have a good 13 pairs of eyes on you, and that generally caters for a wide range of learning styles and different levels of development. With those that are much more advanced in their clinical skills, they often need less kind of direct supervision, and that just allows the tutor at that time to focus on those that then need that supervision. And you can break kind of a task down into much smaller steps for those individuals, and then provide feedback at those individual stages.
What would you say is a highlight for you when you're teaching students? What gets you excited?
Yeah, so I think seeing them being able to perform. So I really like the clinical side of things in terms of teaching, and I think seeing them being able to perform some of those tasks. And actually, particularly with the last cohort, I think some of them were producing crown preparations that were even kind of better than qualified dentists and myself. And it's really exciting to see how developed some of these students are, and some of the skills that they possess. So I really do enjoy that aspect of the teaching side of things.
Oh, thanks.
No worries. So I think on that side of the building, that's where the NHS, the various floors and the various different specialties are. So you've got your peds and orthodontics on the first floor. You have your restorative clinics on the first and second floors, and then you've got your monospecialty areas as well, such as your endodontics, your restorative, and your prosthodontics on those different floors as well. And then the third floor is just purely kind of university activity. So we're on the second floor now. We'll head down to the first floor now.
So why the setup for dental hospital for students to learn in?
So I think traditionally the undergraduate course has been taught in hospitals. So I think it follows that kind of same setup that's been pretty well established over the last, I think, 50 to 100 years really. I think also it allows the various specialties to be in close proximity together, because in the hospital a lot of patients are referred that require much more complicated multidisciplinary care, and so that just allows the various specialties to interact with each other in quite close proximity, and the students can observe that as well and get experience of much more complicated treatment, so that they are better be able to manage patients in a primary care setting, and also understand what can be referred and what's appropriate to refer and what's appropriate to treat as well.
Do you find the patients, or do the patients find you? How does that process work of
For
getting...
For the students? Or
Yes.
Okay, that's a really good question. Again, so we have undergraduate student clinics that have patients specifically that have applied to be on a undergraduate student clinic effectively. There are caveats to that, so the patients have to have longer times for their treatments.
Yeah.
They are having treatment done from an unqualified dentist, so there are certain levels of risks associated with that, but they are being supervised by qualified dentists closely, and they don't have to pay. It's just they pay for their time with their time effectively, so it can just take a little bit longer for treatments to come to their kind of completion.
Do you find that you struggle to get patients that'll come and volunteer, or you're oversubscribed? How would you say it?
I think I think with the various specialties, so for the general kind of clinical practice clinics, they may be relatively oversubscribed. But when you look at the individual specialties and when you're trying to teach something specific, for example, complete dentures now, there are not many patients that we're able to identify that have that require that treatment need. So I think you can get a lot of patients come to the hospital, but then for the teaching purposes, there may be some specialties that are more susceptible to not having that number of patients required to get the adequate teaching effectively. So that's always been an issue amongst undergraduate teaching, of having the right type of patients for that specific specialty.
Yeah, now that makes sense. And even you saying that, it tends to be oversubscribed for patients that will come be seen for general treatment by the students.
Yeah.
With all that's happening in the country, access to
Exactly.
dentistry, it makes perfect sense.
Exactly. So, how we do, there are some screening clinics that we often do where we screen a bunch of patients to see if they're appropriate for undergraduate care, and they then get filtered onto a waiting list for the various specialties. And that's a staff-led aspect. And then the students pick it up from that waiting list. Okay, so you've got your main research labs. These are your tissue culture. So I'm working in one of these, and this is where all the cell work occurs effectively. So yeah, it's really fully kitted out.
What are you working on?
That's an interesting question. So we're growing stem cells from apical lesions, effectively, and then we're applying different interventions to them to see if they increase their kind of cellular response in a way. And that gives us kind of indications of actually the treatment that we're doing is actually having a positive impact at a cellular level. And that provides proof of concept to then proceed on to clinical trials, effectively providing that intervention to patients and then looking at the clinical outcome. So it's about developing, I suppose, a hypothesis and then building it up from an in vitro kind of non-cellular level to a cellular level. You can then take that forward into an in vivo mouse model, and then you can then proceed on to actual patients, and present that work and get some funding for it.
So this is almost like a different world to clinical dentistry.
Yeah.
How do you find it being in research?
So it's a really good question. I think when I look back, I kind of liken it to when I was, for the first time, kind of was on the clinical skills suite with the phantom head, holding a handpiece, learning the basics, because it is a complete different field in a way that has a relation and will have an impact on dentistry. But there's a certain level of skills that I think you will need to develop in order to be successful in this area as well. I think one of the things that we like as dentists is we like to see a result quite soon on. So we do a filling, we see the result, we get a bit of satisfaction from that. But research is completely different in that you can go weeks and weeks without seeing a result, or it would take weeks and weeks to get a result.
Yes.
And then even then, it may be not the result you want to see.
Yeah.
So it's about, I think, that's a different, I think, level of, or an understanding you need to have about the field. It's inherently, you have to wait for a lot of the results, and you have to do a lot to achieve that in an area that you're not familiar with. So,
what's the typical framework in terms of the team that you work with when doing research projects? What's that process like from concept to actually executing that concept and maybe getting it published? So
I think first is to develop a hypothesis initially, and then you need to appreciate the impact that it could have. It needs to be worthwhile in terms of proceeding forward, because going forward with these things take a lot of energy, a lot of money, a lot of people's time. So it needs to have a meaningful impact. Then once you've done that, you need to then build the team around you with the appropriate skills to be able to carry that project forward. Developing a methodology, then after that, the most appropriate way to test that hypothesis is then next on the list. Then, which is really important, is to apply for some funding and some ethics as well. Everything needs to be done in an ethical manner to make sure things like human tissues are being respected. Patients are not going to be undergoing any kind of nefarious interventions, or their tissues are being handled in the right way. Once that's all completed, then it's about performing the task and then carrying out and developing and having checks along the way to make sure that things are going correctly. Once you've done that, you then analyse the data, kind of interpret any kind of conclusions that you can from that, and then you publish that into a paper and present that. So
it's a whole different world.
Yeah, no, it is. Yeah.